Good morning. Today, my group and I will be presenting to you our final paper topic entitled Mobile Solutions for the Mentally Ill Homeless Population in Los Angeles. The goals of our presentation are to first address homelessness as a significant public health issue on a national scale in the U.S., with special attention to the relationship between homelessness and mental health. Next, we will target the city of Los Angeles as a significant center of homelessness and address the need to create effective and innovative interventions. Then we'll address the severity of homelessness on the national scale and in Los Angeles in particular. Examine the existing services available to the homeless population in Los Angeles, and then propose a novel intervention to address the mentally ill members of the homeless population in the city of Los Angeles and county. Though no strict or single definition of homelessness exists, HUD defines homelessness as when an individual, family, or household lives with a fixed, regular, and adequate nighttime residence, or with a primary nighttime residence not designed for or ordinarily used as regular sleeping accommodation for human beings. The McKinney-Vento Homeless Assistance Act, signed into law in 1987 and reauthorized in 2009, was the first piece of federal legislation to address homelessness on a national scale in the United States. On a federal level, it states that homelessness occurs based on this definition. However, nonprofit organizations provide slightly more complex and less mechanical definitions of the problem. The National Alliance to End Homelessness, in particular, views homelessness as occurring when people or households are unable to acquire and or maintain housing they can afford. Factors contributing to homelessness may vary among individuals, but are generally tied to similar social and health-related issues. Generally, structural influences, including war, poverty, struggling economy, a lack of public assistance, and lack of affordable housing, strongly contribute to the homeless issue in America. More individual-level factors which contribute include job loss, foreclosure, domestic violence, family breakdown, physical disabilities, and substance abuse. Each year, the U.S. Department of Housing and Urban Development, also known as HUD, delivers its homeless assessment report to Congress. This report uses a point-in-time measure which identifies sheltered and unsheltered homeless people on a given night, and also uses a 12-month period prevalence collection method. HUD found that as of January 2011, almost 700,000 individuals were homeless in the United States. Given HUD's relatively narrow definition of homelessness, however, the National Law Center on Homelessness and Poverty estimates that 3.5 million people are homeless in the United States each year. Of homeless people living in the United States in 2010, 78% were adults, 58% were racial minorities, and 26% had a mental illness, which is of particular interest to our paper. Particularly given movements toward deinstitutionalization in the late 20th century, a great portion of people experiencing homelessness struggle with mental health issues. Because mental health issues are exacerbated by stress involved in living in shelters or on streets, it's difficult to determine whether mental illness is a cause or a consequence of homelessness. Still, untreated mental illnesses often complicate treatment providers' ability to effectively address the population already so difficult to identify and serve. In acknowledging issues of homelessness through the lens of mental illness prevalence, then, our research aims to offer a treatment-based intervention strategy toward eradicating homelessness with special attention to the case in Los Angeles.
So I'll be talking about homelessness in Los Angeles, California. So on any given night, the locations that people classified as homeless reside are rehabilitation facilities, hospitals or jails for 11%, homeless shelters for 24%, with family and friends but not as a primary residence, 10%, and in places that are not meant to be livable, 55%, the vast majority. And Los Angeles is particularly noted for the fraction of its homeless that are unsheltered in any regard. In 2009, 96,169 homeless were estimated to reside in Los Angeles County. And the way this estimate is arrived at is that the Los Angeles Homeless Service Authority, called LAHSA, conducts a biennial homeless count. And this is done on census tracts and with a combination of street walking to count the sample of the homeless population, and also by shelter visitation and counting there, and then also by doing a daytime count, a youth count, because the youth typically tend to be out during the day but not at night, and in the homeless population. And then also finally a telephone survey of homeless that are already in Los Angeles Continuum of Care programs, which is anyone that's in some form of a care program in Los Angeles for homeless. And this is done to estimate the amount of the hidden homeless that would be undetected by the other methods. So 96,169 in the county, 58,800 in the city, and 9% of the county estimate resides on Skid Row, which is a very highly concentrated population of the homeless, geographically. There are about 15,000 under 25 and 15,000 over 56 in the county, and the rest are in the middling age range. And then about 26,000 were mentally ill, 14,000 in the city in 2009, 38,000 substance abusers, 25,000 in the city. The overall count decreased by 3% in the county and 9% in the city 2 years later with the next count. And the revised estimates, essentially for both mental illness and substance abuse for both county and city, was about 33%. This is anywhere from 32 to 34%. So some of the costs associated with the homeless in financial terms are that, for instance, for a 46-year-old and older homeless, unemployed with coexisting mental health and substance disorders, which is our target population. Public costs, on average, totaled $5,038 monthly, and this is due to relief aid, but also due to specialty services, such as the need to receive like mental health care at a hospital, or rehabilitation services. In Skid Row alone, the hospital services averaged actually $39,316,000 per year. So, drug and alcohol dependence, as mentioned, are common determinants of homelessness, but they're the most common reasons for homelessness in LA County for both families and individuals. And some of the barriers studied to exiting homelessness in Los Angeles are having a mental health condition, which is, as mentioned, usually consists of schizophrenia or bipolar disorder or some affective disorder like depression. Addiction to substance or alcohol, and then also competing priorities, such as which prevent the access to or the pursuit of care for the two foregoing conditions, because the homeless view these as more important, naturally. And so these competing priorities are food, shelter, a place to wash and to use the restroom, and access to clothes. And then another barrier to exiting homelessness is not being referred by people to these sites of care. And chiefly, the most success comes from people referring outside of the formal healthcare system. And then also, finally, a denial of the substance abuse problem, which leads to the inability to even pursue the treatment at all. And then you can see that this would all perpetuate the mental health problems and the addiction problems, because these are barriers to accessing care, and those being determinants of homelessness would therefore cause these people to continue to be homeless, and this is a vicious cycle. So, some of the potential indicators that we might use to assess the impact of our intervention would be, for instance, because the LAHSA surveys are conducted along census tracts, questions could be added to the surveys to assess the degree of mental health and substance abuse intervention access. So for instance, the percent of yes answers to the question of whether they have ever utilized our or any mental health and substance abuse interventions, or the percent of yes answers to the question of whether a mental health or substance abuse condition is currently preventing their exit from homelessness. And so a reduction in the fraction of yes answers would represent progress due to our intervention or due to any other intervention in the same vein. And then finally, because of the Emergency Medical Treatment and Active Labor Act, which is the mandate by which emergency health services must be supplied upon presentation at an emergency department, and this is the route by which homeless would be expected to receive their emergency medical care, as they can't typically afford care otherwise. Further indicators could be constructed by working with the hospitals to identify the patients that are homeless upon presentation, and then therefore we could measure the fraction of people in Los Angeles County or city who receive emergency mental health treatment for either non-admitted patients arriving at an emergency department or admitted patients that are definable as homeless. Another indicator would be the fraction of people admitted to hospitals or presenting to emergency departments for specifically drug or alcohol-related toxicities who are also definable as homeless. And then finally, another one could be the fraction of people admitted to hospitals or presenting to emergency departments for drug or alcohol-related health complications, but not acute toxicity, who are definable as homeless.
So there are various current interventions in Los Angeles that aim to reduce the rate of homelessness and ultimately eliminate homelessness. So as previously stated, the rate of homelessness in Los Angeles exceeds the national average, but actually more accurately, the raw numbers, the population of homeless in Los Angeles is greater than any other U.S. city. So ultimately, more people suffer from homelessness in Los Angeles than anywhere else in the U.S. Currently, there are hundreds of interventions that target homelessness. But despite the hundreds of agencies and organizations that currently provide programs aimed at eliminating homelessness, it still remains a major issue in Los Angeles. LAHSA, which was currently discussed, the Los Angeles Homeless Service Authority, is the leading force for homeless services in Los Angeles. It's created by Los Angeles City and County, and it's an independent agency that targets providing support and funding to agencies and organizations that that aim to ultimately eliminate homelessness. LAHSA works under the Continuum of Care framework, which was established by HUD, and basically the continuum of care is an integrated system of care and planning. It's a planning body, and also indicates a geographic and political location. So LAHSA works under this framework to determine which agencies and organizations to fund and how to fund them. Now, LAHSA, as the leading support for homeless services in Los Angeles, supports over 300 programs that originate from over 100 organizations and agencies throughout LA. The services are divided into 5 divisions: adult services, child and family, substance abuse, suicide prevention, and training. And within substance abuse, mental health is sort of embedded in that, and also in suicide prevention. So although mental health is not indicated as a major division, mental health is of a great concern, and mental health services have been integrated into many of the programs that are currently available. Though, despite the current efforts, homelessness remains a major problem in LA, and the number of homeless still exceeds the national average numbers.